There is a gamut of valve disease, as one can imagine. As I mentioned, there are 4 valves in the heart. I'm going to focus on aortic valve disease, just again, to give you a flavor. It would be too exhaustive to go through every valve and every disease, but just as an example, and this applies to all of the valves, valves can either be narrowed or leaky or a combination of both. Perhaps one of the most commonly understood disease states is something called aortic valve stenosis. So the aortic valve, as a reminder, is the valve that leads from the left side of the heart when the heart squeezes and pumps through the aortic valve, and blood goes to the brain and the rest of the body. So it's a very important valve. A healthy aortic valve has 3 components to it, kind of like a Mercedes sign. And these 3 leaflets open to allow blood to go through and then close to prevent blood leaking backwards. Now, what happens over time with age and degeneration of the valve is that calcium builds up on the valve and it becomes very stiff and very restricted. And so you can see here that the valve clearly looks much more diseased compared to the normal healthy tissue. But importantly, the valve, when it's diseased in its restriction, is no longer able to open. And why is that important? Well, it's because when blood tries to be ejected from the heart and pumped around the body, it can no longer be ejected in the same way through this narrowed, restricted valve. And so less blood is going to the rest of the body, and importantly, less oxygen is being delivered to all of the vital organs. And so patients may present with a combination of symptoms, which can include, but not limited to, fatigue, shortness of breath, chest tightness, dizziness, or passing out. And it's a very common condition, particularly in patients above the age of 75. Approximately 8 to 10% of patients may have this disease. Now, previously, open heart surgery was the only way to treat these patients. And as you can imagine, open heart surgery is very invasive. There are a lot of risks associated with it, particularly in elderly patients. And it's associated with a prolonged hospital stay and a prolonged recovery, naturally, when you're cutting through the chest bone. Now, what's been a marvel in modern medicine is to be able to replace a valve through a small incision in the leg with the patient awake, not under general anesthesia, but with sedation. We pass a wire through the diseased valve. We balloon it to help open it up in some instances in case it's very stiff. And then after we balloon it, the valve starts to open up a little bit more. We remove the balloon. And remember, this is all done through the artery in the leg, through an incision that's less than 1/3 of an inch. We then place a brand new valve through a small tube through that small incision in the leg. These valves, there are different types available on the market. This valve that's being depicted in this animation here is the valve that I use in over 90% of my cases. And these valves are crimped down onto a balloon, and that allows us to put it through a very small incision in the artery in the leg more than 95% of the time. So this is truly a remarkable shift from traditional open heart surgery. We manipulate this device over a wire. We do this under X-ray in the cath lab, and we carefully go around the aorta, which is the main artery that leads from the heart, and we very carefully position this valve gently through the diseased valve. So we're not taking away your current valve, but simply placing a new valve within it. And you'll see from this animation, the valve is aligned and it's centered, and we take great care to make sure it's in the right spot. And then what we do is we actually expand this valve after we found ourselves in the right position, and it expands with a balloon, and you'll see the balloon going up shortly. As the balloon expands, this new valve opens up, and in place of the old valve, which has been crushed to the side, you basically now have a brand new functioning valve. Now, these valves are made of a very thin metal frame, and the tissue on them is actually made from heart tissue from either a pig or a cow, depending on the type of valve. We pull the device out, and what you're left with is this tube, which is then pulled out. We simply cinch down a suture to close up that little incision in the groin. We pull out the wire, and you're left with this brand new valve, as good as the day you were born, sitting in there well anchored. And if you remember that picture I showed you, the disease versus the normal valve, you can appreciate that this is a perfectly normal valve. It's not calcified, and it's opening and closing freely.